It is very important to understand the difference between HIV and AIDS. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system. Think of the immune system as your body's personal army. It is designed to fight off infections and diseases to keep you healthy. When HIV enters the body, it specifically targets and weakens this army. This makes it much harder for your body to defend itself against illnesses. HIV is the virus itself, the microscopic invader that causes the problem. Without any medical intervention, the virus can cause serious damage over many years. So what is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is not a virus, but rather a late stage of HIV infection. It is a diagnosis given when a person's immune system has been severely damaged by the virus. A doctor might diagnose AIDS if the number of immune cells, called CD4 cells, drops to a very low level. They might also diagnose it if the person develops certain serious illnesses, known as opportunistic infections. These are infections that a healthy immune system would normally be able to fight off easily. It is crucial to remember that a person does not catch AIDS, they can only get HIV. The connection between HIV and AIDS is a direct one. HIV is the cause, and AIDS is the potential outcome if the HIV infection is left untreated for a long time. Imagine a small crack in a dam. That crack is like HIV. If you don't repair it, the crack will grow larger and larger over time. Eventually, the dam could break completely. That breaking point is like a diagnosis of AIDS. The good news is that we now have excellent ways to repair that crack. With modern medicine, people with HIV can prevent their condition from ever progressing to AIDS. This brings us to a very hopeful point. Today, an HIV diagnosis is not what it was decades ago. Thanks to incredible medical advancements, contracting HIV does not mean a person will develop AIDS. We have powerful treatments that can control the virus effectively. These treatments allow the immune system to stay strong and healthy. This means that a person living with HIV can live a long, full, and healthy life. They can have relationships, families, and careers just like anyone else. The key is knowing your status and getting the right medical care as soon as possible. To understand how serious HIV is, we need to look at what it does inside the body. HIV's main target is a specific type of white blood cell called the CD4 cell, or T helper cell. These cells are like the generals of your immune system's army. They are responsible for identifying threats like bacteria and viruses. They then signal other immune cells to come and fight the infection. HIV is very clever. It invades these CD4 cells and uses them to make more copies of itself. As the virus multiplies, it destroys the CD4 cells it used. This process slowly weakens the entire immune system. Over time, as more and more CD4 cells are destroyed, the body's ability to defend itself diminishes significantly. When the number of these cells becomes very low, the body is left vulnerable. This is when a person might start getting sick more often. They could develop infections that a person with a healthy immune system would easily overcome. Early signs of HIV infection can sometimes feel like the flu. Symptoms might include fever, a sore throat, fatigue, and a rash. However, many people have no symptoms at all for years after being infected. This is why you cannot rely on symptoms to know if you have HIV. It is vital to know how HIV is transmitted so you can protect yourself and others. HIV is found in certain body fluids, including blood, semen, vaginal fluids, and breast milk. The most common way HIV is spread is through unprotected sexual contact with someone who has the virus. Sharing needles or syringes for injecting drugs is another major way the virus is passed from person to person. It can also be transmitted from a mother to her baby during pregnancy, childbirth, or breastfeeding. However, with proper medical care, this risk can be reduced to almost zero. Just as important is knowing how HIV is not spread. There are many myths out there that cause unnecessary fear and stigma. You cannot get HIV from everyday contact. This means you are safe when you hug someone, shake their hand, or share a meal with them. You cannot get HIV from sharing toilets, drinking fountains, or dishes. The virus does not survive on surfaces or in the air, so you cannot get it from coughing or sneezing. It is also not transmitted by mosquitoes or other insects. Understanding these facts helps us treat people living with HIV with the compassion and respect they deserve. The best way to stop HIV is to prevent it from spreading in the first place. There are several highly effective methods you can use to protect yourself. When it comes to sexual contact, using condoms correctly every single time is one of the most reliable ways to reduce the risk of transmission. For people who inject drugs, it is critical to never share needles, syringes, or any other drug equipment. Many communities offer clean needle exchange programs to help people stay safe. These simple steps can make a huge difference in preventing the spread of the virus. Beyond these fundamental practices, medical science has given us powerful new tools for prevention. One of these is called PrEP, which stands for pre-exposure prophylaxis. PrEP is a daily pill that people who do not have HIV but are at high risk of getting it can take to protect themselves. When taken as prescribed, PrEP is extremely effective at preventing HIV infection. Another option is PrEP, or post-exposure prophylaxis. PrEP is a course of medication that you can take within 72 hours after a possible exposure to HIV to prevent the virus from taking hold in your body. Because HIV can be present for years without any noticeable symptoms, the only way to know for sure if you have HIV is to get tested. Testing is simple, quick, and confidential. Many different types of tests are available, including rapid tests that can give you a result in about 20 minutes from a drop of blood or a swab of your mouth. Everyone should consider getting tested for HIV at least once in their lifetime as part of their routine healthcare. People with certain risk factors should get tested more frequently, perhaps once a year. Knowing your status is the first step toward protecting your health and the health of your partners. Getting tested is a powerful act of self-care and community care. If you test negative, you can take steps to ensure you stay negative. You can use this knowledge to make informed decisions about your sexual health and learn more about prevention methods like PrEP. If you test positive, you can start treatment right away. This is the most important thing you can do to protect your health. Early diagnosis and treatment mean you can keep the virus under control, keep your immune system strong, and prevent passing the virus to others. Knowing your status empowers you to take control of your future. If a person tests positive for HIV, the next step is to begin treatment. The treatment for HIV is called antiretroviral therapy, or ART. ART is not a cure, but it is a highly effective way to control the virus. It usually involves taking a combination of medicines every day. These medicines work by stopping the virus from making copies of itself inside the body. By blocking HIV at different stages of its life cycle, RT reduces the amount of virus in the blood, which is known as the viral load. This gives the immune system a chance to recover and get stronger. The goal of ART is to reduce the viral load to an undetectable level. This means the amount of HIV in the blood is so low that a standard lab test cannot find it. Reaching and maintaining an undetectable viral load is the best thing a person with HIV can do for their health. It allows their CD4 cell count to increase, strengthening their immune system and protecting them from opportunistic infections. A person with an undetectable viral load can live a long and healthy life. Modern ART is also much simpler than it used to be, often involving just one pill once a day with few side effects. One of the most incredible discoveries in recent years is that having an undetectable viral load also prevents the transmission of HIV to sexual partners. This concept is known as undetectable equals untransmittable, or U equals U. When a person with HIV is on ART and maintains an undetectable viral load, they have effectively no risk of transmitting the virus to an HIV-negative partner through sex. This is a life-changing development that has reduced fear and stigma. It reinforces why starting and staying on treatment is so important, not just for one's own health, but for the health of others. Today, we have the tools to end the HIV epidemic. We can achieve this by making sure everyone has access to testing, prevention, and treatment. We need to continue to fight the stigma that surrounds HIV by educating ourselves and others with facts, not fear. Supporting people living with HIV is crucial. We must ensure they have the medical care and social support they need to thrive. By working together with compassion and determination, we can create a future where new HIV infections are rare, and everyone with HIV has the chance to live a long, healthy and fulfilling life.